Thank you, Mr. Chairman. It's a privilege to have the gavel. I won't abuse it. And thank you, Madam Secretary, for reaching out before this hearing and seeking my counsel. Of course, I had none for you, except to say that we have differences on this budget. I agree with what Senator Bennett just said about the importance of our Kids Health Act, which is called the ACE Act, which will help, as he said, improve care, but also reduce costs. Love to work with you on that. We do have some differences on the big picture, you know, $3.3 trillion in new taxes. You and I have talked about some of these fiscal challenges we faced and aren't resolved in this budget. But I want to talk about something that I like in the budget, and that's the work on opioid addiction. So prescription drug and heroin addiction is at epidemic levels in my state and around the country. And we're losing, as you indicate, lives every single day. We lost over 2,300 Ohioans last year alone. We have, over the last 3 years, been working on legislation that is bipartisan, comprehensive. We've had over a dozen meetings up here with experts from around the country. We've tried to bring in the best people to figure out how do you get at this problem. You and I have talked about it, and you have reached out to me, and I appreciate that, over the last several years on this issue. That legislation called CARA, Comprehensive Addiction and Recovery Act, just passed the Judiciary Committee while you were testifying. And it passed, as I understand it, by a voice vote. In other words, it was unanimous. That doesn't happen around here. And so I'm going to thank you for what's in the budget, because what you put in the budget is consistent with CARA.
It is.
And provides more funding specifically for treatment. One of the things I like about your budget is it also provides some funding to look at, and I'm reading from your budget, evaluating the effectiveness of treatment programs. So it's research at the federal level on best practices, because not all medication and treatment programs are equal. Some work better than others. And some that I've visited in Ohio have incredible results. Others, frankly, are struggling. And so I think that's important, too, at the federal level to provide that. So I encourage you to continue to do that. I know you have a personal interest in this and a passion for it. Senator Whitehouse is the other co-author of this, but we have a bipartisan group. We have over 120 groups around the country who have now supported us on this, including the National Association of District Attorneys, the Attorneys Generals. I think 38 of them have now endorsed the bill. The groups that represent the people who work in the trenches every day in the states, they've endorsed it. This is one that we can actually get done. And I know that the White House has said generally good things about the bill, but has not been willing yet to say that they support it. I hope you will support it. I hope you will get behind it. We understand there has to be funding that goes along with it, and that's why I think the budget is a step in the right direction. The funding that we got in at year end will help, but we will need additional funding to be sure that the legislation, which is an authorization, can actually be implemented in the proper way. I wonder if you had any thoughts on CARA you could share with us today.
First, thank you for your leadership in the space. It's important to the progress that I think we can make in terms of a number of folks, and you certainly have been a strong leader and appreciate our conversations about these issues as well. I think, as you said, it aligns with the strategy that I articulated earlier in this hearing that the bill does. I think we want to continue to work, and I'm hopeful. I think, you know, I just have 11 months. And so the idea that we can put in place the things, I hope that we'll start to see the results of our efforts, but it's going to take longer. But the idea that we can put in as many as possible of the things that I think we need to do, and that support for the medication-assisted treatment, as well as these prescriber issues that we're going to face when we get the new guidelines. So we look forward to continuing to work with you on it. Glad to hear about the vote. I obviously was here, so did not know.
Mm-hmm. Well, thank you. And we are encouraged by the vote and also by the amount of support we're getting from around the country on this. And I think the administration weighing in more precisely on this legislation would help us to get it through the process without what often happens around here, which is political games. And we're going to see it. People will offer amendments to it to try to kill it. People will say this is about politics. It's never been about politics. We've been working on this for years. We've kept it not just bipartisan, but nonpartisan. But we'd love your help to get this to the President's desk, where I believe he'd be very pleased to sign it, to start this new strategy, to be able to have the federal government play a more important role, a better partnership role with state and local government and nonprofits to address what is a crisis in our communities. There's other legislation, as you know, that Senator Toomey and myself, Senator Brown, and others have introduced. It's called the Stopping Medication Abuse and Protecting Seniors Act. This helps us to be able to save lives by reducing the likelihood that patients in Medicare are doctor shopping, getting prescriptions for pain medications from multiple doctors, multiple pharmacies. We've got co-sponsors on both sides of the aisle. We know these programs work in the private plans. CMS administrator testified several weeks ago that Medicare is prohibited from using this important tool. And I know your budget touches on this, but I wonder if you could comment on that legislation and your view on this and whether we can also move that legislation forward to avoid some of this prescription drug abuse that is causing the problem.
As was commented by CMS in terms of our ability to do it, I think you know it would come statutorily. We see Medicaid programs in states doing it as well as the private sector. I think the one concern we just want to make sure is that we don't make access too hard. Pain is an important issue in terms of the issue, and so I think we agree we can do a much better job, which I think is what the objective of the bill is, in terms of controlling this access to these drugs in terms of providers and pharmacies. Just want to make sure we do it in a way that doesn't inhibit access for those who actually need it.
Thank you, Madam Secretary. Look forward to working with you on that as well because it does require a statutory change. Thank you, Mr. Chairman.